and welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Made up of the glands that produce hormones, the endocrine system regulates almost everything that happens in the body, controlling growth, puberty, processing food and water, and maintaining the proper levels of blood sugar. The pituitary gland is the master gland controlling all the hormones in the body, and if the gland goes wrong, then people can suffer from a range of symptoms and conditions. These are rare and can be tricky to diagnose, so more awareness is needed to promote quicker diagnosis and better care. We have with us eminent endocrinologists to provide medically accurate advice on preventing various endocrine conditions related to the pituitary gland and help viewers identify long-term control strategies. Today we're joined by Dr. B.K. Roy, Senior Consultant Endocrinologist, Apollo Hospital, Noida. Dr. Ajay Hanumanthu, Consultant Endocrinologist, Assistant Professor, Department of Endocrinology, JSS Medical College, and Dr. Jaspreet Singh, Associate Consultant Endocrinology, Fortis Hospital. Thank you so much, doctors, for joining us on the program today. And Dr. Roy, first to you. The endocrine system controls most processes in our body, from growth to reproduction. What are the different parts of the endocrine system?
See, the glands which makes hormones are called endocrine glands. So there are 6 main endocrine glands in the body. The most important is pituitary gland, which is a pea-sized gland situated in the lower part of the brain, and it makes 8 important hormones which controls other hormones. That is why it's called master gland. And pituitary gland deficiency leads to many symptoms, from short height to infertility to weight gain and many others. The second important hormone is thyroid, which you all must have heard, which is a very common condition. So thyroid is a gland which is situated in the neck, and it makes thyroid hormone T3 and T4. Deficiency of this hormone T3 T4 is called hypothyroidism, and excess of this hormone T3 T4 is called hyperthyroidism. Third gland is parathyroid gland, which is situated just behind the thyroid. It is 4 in number, and it makes PTH hormone. The full form is parathyroid hormone, which maintains calcium balance in the body. Then fourth hormone is adrenal gland. Adrenal gland is situated in the abdomen just above the kidney, and it makes 3 important hormones. One is cortisol, which is very important for maintaining body metabolism. Second is aldosterone, which is very important to maintain sodium, potassium and blood pressure in the body. And third hormone is adrenaline, which is very important for maintaining BP and other functions. Then our fifth gland is pancreas, which is situated in the abdomen, and it makes very important hormone insulin, which you all know about it. It is important to manage blood sugar and maintain normal blood sugar in the body. Then the sixth hormone gland is gonad. In male is testis and female is a ovary. In male, testis is very important gland which makes male hormone testosterone and sperm. As you all know, testosterone is important to maintain male features, male secondary sexual character like beard, mustache, good muscles, good libido, and similarly testis makes sperm, which is important for fertility. In female, gonads are called ovary, which is there to make female hormone estrogen and to make eggs for fertility. So estrogen is needed for a development of secondary sexual character in females, like breast development and other body features. Plus regular estrogen is also important for menstrual cycle, having normal regular cycle. So these are the important glands which does very important body function to maintain and run body in normal healthy condition.
All right, Dr. Hanumanthu, what does the pituitary gland do, and how does the pituitary gland affect everyday life?
Yeah, first of all, thank you for having me here. Now, pituitary, as Dr. Roy was saying, is the master gland. This is the endocrine organ which is very essential, and it orchestrates the function of all the different endocrine organs in the body. Now, the pituitary is a very tiny pea-sized organ which is present in the base of the brain. It is just 600 milligrams approximately. And though it is such a tiny organ, it produces many hormones, and these hormones are produced in response to the amount of existing hormones in the blood. Now, for example, when the thyroid starts producing thyroid hormones and this thyroid hormone enters into the circulation, this thyroid hormone is sensed by the pituitary, and if the pituitary senses that this particular hormone is less, then it goes on and produces a stimulating hormone, which is known as TSH. Now, such stimulating hormones are produced in response to the levels of hormones in the body, and pituitary, by assessing or by estimating the amount of hormones in circulation, goes on and increases or reduces the production of different hormones. Now, it's a very important organ because of the fact that it is controlling all the different endocrine glands in the body. So, if there is any affection of the pituitary, that is, if there is a pituitary apoplexy or an infarction or damage to the pituitary, then all the signaling hormones that are being produced from the pituitary or some of the hormones may get affected, and this will lead to multiple pituitary hormone deficiencies or isolated pituitary hormone deficiencies. Now, since this is a very tiny organ and also the blood supply is restricted to this, and there's not a very good blood supply, if there is something which affects the blood supply to this particular pituitary gland, then that there can be very disastrous consequences arising out of it. So this is the master gland or the master endocrine gland.
Right. Dr. Singh, what is hypopituitarism and what are the different kinds that exist?
First of all, I want to thank NDTV for a great initiative in having me here. Coming back to hypopituitarism, hypopituitarism is a condition in which there is a deficiency of one or multiple hormones of the pituitary gland. So there are mainly pituitary is divided into anterior and posterior pituitary. Anterior pituitary releases 6 hormones and posterior pituitary releases 2 hormones. These hormones are mainly growth hormone, thyroid stimulating hormone, prolactin, LH-FSH and ACTH. From anterior pituitary and from posterior pituitary we have vasopressin and antidiuretic hormone. So there are mainly 3 kinds of hypopituitarism. First is isolated pituitary hormone deficiency, in which there is a deficiency of a single hormone line. Like if growth hormone is deficient, the child is going to have a short stature, or if the gonadotropin is deficient, the child will be having pubertal problems. Then we have, secondly, we have multiple pituitary hormone deficiencies, in which multiple pituitary hormones are involved, where growth as well as puberty are affected, or any other systems can also be affected. Then thirdly, we can have pan-hypopituitarism, in which all the 8 cell lines, all the 8 hormones secreted by pituitary will be deficient, and the patient will be having polyuria, diabetes insipidus, in addition to the all hormone deficiencies.
Right. Dr. Roy, now talking more about this issue of hypopituitarism, can it affect anyone at any age, though it's a rare condition? What are the common causes of it?
See, hypopituitary is not that rare cause. See, the causes of hypopituitary from childhood till adult, it may vary. Like in young child is born, there can be congenital deficiency of growth hormone leading to short height. Similarly, there can be congenital that from developmental defect in the uterus, there can be deficiency of LH and FSH hormone that will lead to this absence of puberty in boy and girls, leading to no developed breast and period in girls and small testes and absence of secondary sexual character in boys. So it can be congenital from developmental defect. Second can be trauma. At time of birth, there can be trauma to the head leading to deficiency of pituitary hormones. Similarly, any fall from height or any road traffic accident leading to damage to pituitary will lead to hypopituitarism. Then third is any tumors in pituitary gland will lead to compression of nearby normal pituitary, resulting into deficiency of pituitary hormone. Fourth is decreased blood flow to the pituitary, which is very common cause used to be earlier, like during childbirth, women used to bleed a lot. That used to lead to a low blood pressure and leading to decreased blood flow to the pituitary, and pituitary used to get necrosed. So that during childbirth, it was very common cause earlier, leading to total pituitary failure. So even after childbirth, mother never used to have milk formation, and even after many months after childbirth, she never used to have resume of period again. So that is used to call Sihan syndrome. So proper care of during delivery has not decreased, but even in villages this common cause. Then comes any bleeding in the pituitary, either due to high blood pressure or due to some any bleeding disorder, can lead to damage of pituitary. Any inflammatory conditions like histiocytosis, then sarcoidosis can lead to damage to pituitary. Then any infection like tuberculosis, meningitis, or any kind of meningitis can lead to decreased pituitary function. So they are common causes. Then some drugs also lead to like checkpoint inhibitors like anti-cancer drugs lead to pituitary damage. Then there's some functional causes like a chronic use of high dose of steroid like dexamethasone, betamethasone, that is used many times for a medical condition like chronic treatment of asthma, rheumatoid arthritis. So long-term use of steroid leads to suppression of ACTH formation from pituitary. Once they used to stop this steroid, their internal production of cortisol used to decrease. So that's very common cause. Even many boys and girls nowadays to gain weight, they take Dexona, and Dexona leads to suppression of ACTH. This suppression leads to deficiency of cortisol after stopping this tablet. And the moment they stop tablet, they have loss of appetite, weight loss, nausea, vomiting, anxiety, depression. So they are very commonly we come across. Then comes chronic use of a high dose testosterone or high dose of a anabolic steroid like decadurabolin, Neurovol, leads to suppression of LH in the brain. And once they stop this steroid, the testosterone production becomes virtually zero. So for 6 months to 1 year, the testosterone becomes low. They suffer with hypogonadism. This hypogonadism is very common cause. Many times patients come to me. They are taking high doses and they come with low testosterone, erectile dysfunction, low libido, and a lot of anxiety. Similarly, chronic stress, chronic depression lead to suppression of LH production from pituitary, leading to scanty period, late period, or even absent period in girls. And in male, chronic stress, depression leads to low testosterone. So these are reversible causes of hypopituitarism, and which can be prevented also.
Dr. Hanumanthu, what is the role of lab testing in the detection and management of hypopituitarism?
Yeah, lab testing is very essential to diagnose a patient to be having any pituitary hormone deficiency or any hormone deficiency for that matter. So lab testing is very important and has to be done at specific points of time, and also the lab sampling techniques have to be accurate. Now, most of the hormones that are secreted by the pituitary have something known as a diurnal variation in their secretion, and they are pulsatile in nature. So it depends on the time of the day when you do the test as well. So it is always preferable to do this in the mornings between 7 to 10 a.m. And also it is better to be in a fasting state, because after food the levels of some of the hormones are found to be low. And these hormone tests, once they are done, it is only then we'll be able to identify which particular hormone is deficient in a particular person, and then go ahead and replace that hormone in the necessary amounts required to maintain it in the normal levels in the circulation. The other important thing that is to be noted here is that these tests are very sensitive tests and have to be done in accurately monitored and standardized labs which use recommended assay systems. So if we get a false report from a report which is not done in the recommended assay techniques, we might end up having a faulty value, and the patient's therapy might also be affected by this. So it's always essential to have the right sampling technique and do the test from reputed good standardized labs and interpret these tests accordingly. And once these tests are done and the treatment is initiated in a particular patient, the patients have to follow up on the regular basis to adjust the level of hormones that can be given to the patient to maintain these hormones in the optimum concentration in the circulation. Back to you.
All right. Well, with that, we'll slip into a short break and return with more questions for the doctors. Stay with us. Welcome back. You're watching Health and Wellness, and we're talking about hormone health. Let's go across to our doctors. And Dr. Singh, what are the cardiovascular complications of hypopituitarism?
Cardiovascular complications are significantly higher in hypopituitary patients. As we all know that pituitary secretes 6 main hormones. All these hormones have some metabolic functions. So all these patients having deficiency of these hormones, actually they have more of the bad lipids like bad LDL cholesterol in their blood, and they have less of the good cholesterol like HDL cholesterol in their blood. Apart from this, the incidence of and prevalence of metabolic syndrome which is associated with cardiac morbidity is more in these patients. So it has been seen that more of these patients have more cardiac morbidity as well as mortality. Sometimes the treatment related issues like the patient non-compliance or over or under treatment is also associated with bad cardiac morbidity in these patients. Sometimes the pituitary tumor requires radiotherapy, which is also associated with bad cardiovascular mortality or morbidity in these patients.
Right. Dr. Roy, let's talk now about hyperpituitarism. If you could tell us what is the treatment for hyperpituitarism and what is the role of medical treatment for hypopituitarism?
See, as a doctor said, that hypopituitary means deficiency of pituitary hormones. So there are 8 hormones, and all hormones are very important. Starting from growth hormone. Growth hormone deficiency leads to short height in children and weakness and increased weight gain in adult. So in children, we need to give growth hormone therapy so that they gain normal height. At present, there is good treatment of growth hormone deficiency. If we start growth hormone therapy at young age, patient can achieve normal adult height. But treatment during adult of growth hormone deficiency is still controversial unless well documented. Normally we do not give. Second important hormone is TSH deficiency that leads to secondary hypothyroidism. Treatment of that is simply give thyroid hormone replacement by namely Thyronorm, Eltroxin in proper dosage, and then easily treatable, and by monitoring patient can remain healthy. Third hormone is ACTH deficiency, which is very important. Deficiency of this hormone leads to cortisol deficiency. Cortisol deficiency leads to weight loss, loss of appetite, nausea, vomiting, severe weakness, and low blood pressure. Even patient can go in coma and death. So that they need to take lifelong small maintenance dose of steroid. There is one tablet called cortisol. They need to take around 10 to 20 mg daily lifelong. Anytime they become sick, they need to increase the dosage. Then fourth hormone is our LH and FSH deficiency. So in male, LH and FSH deficiency leads to low testosterone. For that, they need to take testosterone injection every 2 weekly, lifelong. And when they're planning pregnancy, then they need to take LH and FSH injection to start sperm production. Once we start LH and FSH injection, within 18 to 24 months, the sperm production become normal and they become father easily. In female, at time of puberty, we start with small dose of female hormone estrogen, and after some time, then we give cyclic 21-day cycle of female hormone, then we stop, they get period. When they plan pregnancy, then they need to give LH and FSH injection. By that, within few months, then egg production occurs and they become pregnant also. Regarding deficiency of a ADH hormone, that is antidiuretic hormone, deficiency of this hormone leads to excess urination. Patient drinks water, goes for a urination. So excess thirst and excess frequent urination is symptom of ADH deficiency. For that, there are ADH tablets are there, ADH nasal spray is there. Just take one tablet daily, your ADH will be replaced normally and you can have normal life. Then comes by treating this hormone, patient can live lifelong healthy life. But they need to take regular treatment and monitoring also.
All right. Dr. Hanumanthu, what is the purpose of oxytocin produced by the pituitary gland?
Yes. So as doctors were pointing out that we have anterior pituitary hormones and posterior pituitary hormones. Now of the hormones, the anterior pituitary produces the maximum number of hormones. The posterior pituitary produces two important hormones, of which one is oxytocin. Now, this oxytocin is a very essential hormone, especially in females. Now, this oxytocin is the hormone which is responsible for the contraction of the uterus that ultimately leads to a normal vaginal delivery. Now, when a patient is not progressing into labor or when there is delayed delivery, we sometimes therapeutically administer oxytocin to increase the uterine contractions so that the patient can have a normal vaginal delivery. This is one important action of oxytocin. Sometimes post delivery, that is after delivery, there might be a lot of hemorrhage that happens after a complicated delivery. Even at this point, oxytocin helps in contracting the uterine musculature and reducing the hemorrhage. Oxytocin is also essential for one very important aspect, that is breastfeeding in a female. So this oxytocin has action on the breast tissue as well. It causes the ejection of milk out of the breast so that the newborn can be breastfed. There are other functions of oxytocin as well, which include many behavioral changes as well. But most importantly, it is the parturition or delivery and milk ejection that are most important. Back to you.
All right. And Dr. Singh, does the pituitary gland affect memory? If you could explain that to us.
Pituitary hormones have a major role in physical health as well as the behavior, cognitive and memory part. They also do have a role. Pituitary is in close proximity with the hypothalamus. Hypothalamus is a part of limbic system and all the memory connections passes through the hypothalamus. These pituitary hormones have a role in the neurological processes. Actually, memory problems and the cognitive and behavior problems are well known in pituitary disorders like in Cushing disease or in secondary hypothyroidism. These patients have some memory deficits and cognition deficits which even stays even after the surgery. So pituitary has this role also. As we know, like pituitary has a role on the physical health, like in Cushing syndrome, the patient has more fat, but along with the physical health, it also has a role in the memory and the cognition part also.
All right. Well, thank you, doctors, for sparing your time and, talking to us and answering all these questions about this very important issue. And with that, time for us to slip into a short break. Thank you all for watching. Goodbye.